Today we have the privilege of interviewing Professor Dr. Victor Hoe regarding COVID-19. He is an occupational physician in UNMC who also teaches at the Department of Social and Preventive Medicine. So thank you, Doctor. The first question we have is, what is COVID-19 and how is it transmitted?
Okay, so COVID-19 is basically a disease, right? A respiratory disease caused by a type of coronavirus. But novel type of coronavirus, which was renamed as COVID-19 by the WHO. So
Yes.
COVID-19, basically called CO is basically corona, VI is virus, D is disease. Alright, so it happens started in November 2019. That's why they named it COVID-19. So the symptom of COVID-19 basically you have cough, usually dry cough, sore throat, fever, and then shortness of breath. So these are some of the symptoms of COVID-19, which is quite similar to flu, right? Only thing flu is basically got a runny nose, which is the main symptom.
So how is this transmitted?
It is transmitted through droplets, alright? So what do you mean by droplets? Basically, droplets are small, what we call water-like things that basically when I talk to you, alright? Sometimes there is droplet that basically transmitted. But usually you get transmitted by coughing, alright? Then when you cough, there's a lot of water droplets coming out. So we know droplets is water, so it's heavy. So it wouldn't spread into, let's say if it's airborne, that it's lighter, it would spread more widely. The droplet basically is heavy, so it land on what we call surfaces, right? So when it lands on here, right, if you don't clean it properly, then you can touch it, you can touch your face, alright, or your eyes, or your nose. That virus can be transmitted, can be transferred to your face, eyes, or nose. So the droplet actually can last for quite a long time, 2 to 3 days sometimes. The coronavirus basically can be as a droplet on the table. That's why it's always good to clean the table, clean yourself, don't touch your face, don't touch your eyes, right? So that is the precaution that people need to take.
That's very informative. The next thing we want to ask is, what are some of the preventive measures we can take as a public?
The preventive measure is that firstly you don't panic, and because it's droplet infection, and it's because it is, if you are sick, and you want to go out, or even at home, it is advisable that you wear a mask. The mask that we suggest or we recommend is basically called a 3-ply mask. Basically a mask with 3 layers, so that when you talk or when you cough, your droplet will basically land on someone else. And after you have basically, when you remove the mask, make sure that it is what we call dispose off properly, so that it does not harm anybody. As the public who is not infected, who has no cough, no symptom, when you go out, basically you need to observe hand hygiene. I think this is the most important part. Hand hygiene, which means that you need to wash your hand regularly, and if you cannot find water, you can use alcohol, scrub to basically wash your hand regularly, Usually before you touch your face and touch your eyes, but sometimes it's quite difficult, but you need to do it.
So how concerned should the public be regarding COVID-19?
It is basically an important disease that causes a lot of problems in many countries. Most of the countries that are kicking off and having big issues is basically South Korea, Japan, China, Italy, and Iran. So the public should be concerned, but they should not panic. They should not be basically avoiding going out, but they should practice good hygiene and good hand hygiene. Hand hygiene is the main thing. So if you think that you are so concerned that I don't want to go out, it stops everything you do, then it's not correct. So let's say you go out, all right.
Yeah.
Now we say, okay, don't shake hands, all right, because we don't want you to, we don't want to transmit the disease back from you to you, all right. So no physical contact,
Yeah.
all right. So if you got no physical contact,
Yeah.
that should be okay.
Yeah. Yeah.
Okay. So if you go out, all right,
Mhm.
don't go to a place that is crowded people.
Mhm.
All right. So if there's no crowded people, that should be okay.
Okay. You mentioned to avoid crowded areas, but however, what are some areas that still have to go on? For example, schools and maybe certain conferences. So how should the organizers manage these scenarios?
Basically, it's quite simple. Is that if you have symptoms, all
Yeah.
right, you should make sure that you don't spread your disease to other people.
Okay.
Not just for COVID, even for flu, even for influenza, it's the same thing.
Yeah.
Wear a mask
Mhm.
before you go out, all right?
Okay.
And then to practice to make sure that if you have your cough, just wear a mask. Nothing much with the other things that the organizer can do. Right? But it depends on whether where you're going is high risk
Mhm.
or low risk. Of course, if you're not sick,
Yeah.
all right, don't go to hospital.
Okay.
All right. If you're not sick, all right, but your friend is in the hospital,
Mhm.
right, try to limit
Okay.
going to the hospital to see your friend.
Yes.
If you're not sick, if your relative is going to the clinic, make sure that, or hospital, make sure that you try to limit your exposure, right? Because we know that although we don't know whether there is COVID in the hospital or not, but it's better not to go to hospital. So if you have small children and things like that, don't bring them to hospital.
Yeah.
Don't bring them to visit relative.
Yeah. Yeah.
So it's better to have limited exposure
Mhm.
as a public.
Okay. You mentioned about small children and avoiding crowded areas, but what are some of the higher risk groups that you
Basically, everybody is at risk of infection. There's no difference between whether you or me get the infection.
Mhm.
But because some people are more at risk
Yeah.
because of their comorbid condition, basically comorbid means they have other diseases,
Yeah.
or they are basically having older age group.
Mhm.
They are higher risk of dying because of infection. They are higher risk of getting more severe infection because of their comorbid condition. So who are these people? Elderly, alright, people who have comorbid condition like diabetes, hypertension, alright, people who basically are weaker, like other respiratory diseases, alright. They should be more concerned than, let's say, you and me, alright, which basically are supposed to be healthy, so shouldn't be.
Lastly, what are some other advice you would have for the public?
For the public, simple. Don't panic, alright? Life goes on. It is just you basically it would be here, COVID, alright, it won't go away so fast, alright. But you need to practice what we always ask you to do, basically to have hand hygiene, to make sure to be hygienic when you do anything. If you have flu, cough, or fever, when you go out, please don't spread it to other people. Wear a 3-part mask.
Okay, thank you so much for the interview.
Alright.
We appreciate it.
Okay, have a nice day.
You too.